Because symptoms of headaches vary widely, it is sometimes difficult to properly diagnose and find the best treatment for a given individual. The best scenario requires an interactive partnership between the patient and the doctor. There are a number of ways in which you can become more actively involved in managing your headache.
When you're treating a headache patient, it's very important to be able to track how well the patient does. Some of my patients are optimists, and if they come to the clinic and they've had 3 or 4 good days, but their past month overall has been bad, they will tell me they're doing well because the last few days have been good. Conversely, if most of the month, in fact, has been good, but they're in the throes of a headache when they come to the clinic, they'll tell me they're doing bad. The use of a headache calendar or diary is a way of getting around that. The patient actually keeps a record on a daily basis of how they did with their headache and brings it to each follow-up appointment. And whether they're 4 weeks apart or 4 months apart, you can tell how the patient's done over that period of time. The other thing that's useful is they will often be able to write something else on the calendar, such as something they might have suspected was a trigger, like the onset of their menstrual period, or what the weather was, or something else. So it's a very good way of taking a good look back in time and keeping it more objective than subjective, which I think makes it easier to use when you want to adjust their preventative therapies in particular.
It's changed my life. I mean, I really feel like I have a new life. It's like amazing to be out from under.
By becoming more actively involved and working in collaboration with a physician or other healthcare provider, people with severe headache can lessen or even eliminate the negative impact that this condition has on their lives.
Anybody, who has a headache should know that it's time to go back to find a treatment that works.
If someone requires medication for their headache more than 2 days per week, or if someone's headaches significantly interfere with their ability to work, study, or enjoy life, despite the use of over-the-counter medication, those are all good reasons to seek medical care, not because there's a serious underlying illness, but because with effective medical treatment, there's a huge opportunity to improve quality of life.